But let's have amyotropic lateral sclerosis, otherwise known as your low-grade disease. Okay? So, CAPS, kapag sinabi nating amyotropic lateral sclerosis or ALS, otherwise known as your low-grade syndrome, still this is part of your neuro. Okay? So, otherwise known as low-grade disease or syndrome. And you need to take note that simply asking if what is the other term for your ALS is already an exam favorite. So, we need to take note of that. Kapatid, kailangang maalala natin yan. Okay? So, it is a progressive, a rare, and I need to highlight this one. It's an incurable degenerative disorder. Okay? Again, it's a progressive, very, very rare, incurable. So, ibig sabihin, walang gamot dito. Okay? It's also a degenerative disorder which involves the motor system, kapatid. Okay? Yung simpleng paggalaw ng ating katawan. Okay? So, ito po yung inaatake ng ating amyotropic lateral sclerosis. By the way, again and again and again, I would like to remind everyone that when we say sclerosis, there is hardening or there's stiffening or there's flaccidity. Okay? So, iyon pong ibig sabihin po ng sclerosis. Okay. So, dito, again, ALS is a progressive, rare, incurable degenerative disorder which involves your motor system. And it is characterized, kapatid, by muscle weakness and atrophy. Again, kapag sinabi nating atrophy, this is the lessening in size. It could be in size, okay, of your muscle. Okay, the loss of muscle tone of your muscles. Okay, so or the loss of tones of your muscles. So kabaliktaran po nito ang ating pong hypertrophy. So again, in your ALS, kapatid, it is characterized by muscle weakness and atrophy. That's why we call it ALS or your amyotropic lateral sclerosis. Okay, so in here, kapatid, nadidevelop din, remember natin, okay, tandaan po natin, if flaccid tetraplegia develops. So kapag sinabi po natin tetraplegia, kapatid, both the upper limbs and the lower limbs or the upper extremities and the lower extremities, kapatid, okay, nagkakaroon po ng paralysis. Okay? Flaccid paralysis. So we need to remember that one. Okay? So, now the problem here or the highest priority gives us to think now that the amyotropic lateral sclerosis may lead to pneumonia. Okay? Which is more of concern now because it's dreadful kapag pinag-usapan na po natin ang respiratory system. Okay? So, remember that your ALS may lead to pneumonia and death. Okay? Now, again and again, no cure is known for this disease and management is symptomatic. Again, it's incurable, so no cure really is known to manage this disease and management is symptomatic. So the question is now, what have caused really? Okay, ano nga bang naging dahilan kung bakit nagkaroon tayo ng amyotropic lateral sclerosis? Okay, considering that it's a rare disorder, that it's a rare disorder involving the motor system of our body. So, ano nga bang naging cause kung bakit nagkaroon tayo nito, no? So, it is cited that excess glutamate, kapatid, has been the cause of our amyotropic lateral sclerosis. So, this glutamate, it's a substance or it's a chemical that's responsible for relaying messages between the motor neurons. So, ngayon alam mo na, kapag magkaroon ng problema, okay, in your ALS, nasira po ang ating motor system because of excess glutamate, which is a substance responsible for relaying messages between the motor neuron. So, dahil excess po nating glutamate, nagiging hype lang. Okay, sumusobra. Okay, yung ating pong relaying of motor neurons. I mean, the relaying of messages to the motor neurons. Okay, so, leading to flaccid type of paralysis, which is hindi lang nag-involve ng isang body part, hindi lang nag-involve ng hemiplegia or tinatawag nating the paralysis of one side of the body, but it includes, kapatid, the entire body now. Okay? So, nagkakaroon po tayo ng tetraplegia. Again, the cause here is because of your excess glutamate. Okay? We need to remember this one. Now, what are those assessments na makikita po natin na patient? Basic. Okay, you think of nawala yung motor neuron, I mean the proper relaying motor neurons. Now, our motor neurons is being attacked. progressively, and it's something that's incurable. So you don't need to think of those assessments na makikita natin. Okay, so first priority po natin dito is respiratory difficulty. So we need to remember that one. Fatigue while talking is also seen in your patients with ALS. Muscle weakness and atrophy, of course, tongue atrophy, or we call it sometimes as your atropic glossitis. Yan. Okay, nagkakaroon po tayo dito ng tongue atrophy, dysphagia, weakness of the hands and arms, again, and fasciculations of the face. Yan. And also, when we try to speak, it's more of the nasal voice. Okay? Nasal voice po. Yung tipong parang may sipon, parang ganon. Okay? Nasal quality of speech. So, these are the set of assessments. So, of course, kapag sinabi po natin ALS, kapatid, our priority here would be respiratory system. Okay? So, take note of that. Also, articulation difficulty or dysarthria is also evident in a patient with low-grade disease. Okay, so now what are your interventions? I've said this earlier that your interventions firstly should be primarily symptomatic. Okay, symptomatic management, and of course, our priority here would be your monitoring of respiratory status. And guys, of course, you need to prevent aspiration in a patient with ALS. That's a favorite PNLE, NCLEX, and even at nursing exam questions. Okay, so we need to remember that one. Prepare also respiratory support. So, dapat nakahanda po yan. And assess for complications of immobility. Okay? And also, psychosocially, you need to address advanced directives as appropriate. Because again, as we tell, that your ALS is incurable. No known cure for this rare disease is known. Okay? So address advanced directives as appropriate or as necessary, as deemed appropriate or as necessary. And also provide client and family psychosocial support. Because there is what we call as your anticipatory grieving. So we need to remember that one. Okay? So thank you so much for being with me on this concept. See you guys on the next topic that we'll be having. Have a good day.